Hello Australian community, I'm back here with Bouzis D.D.S from America, and we are very excited being here in Brazil because we don't need to dress up. So we just feel relaxed.
Very relaxed.
Very relaxed. And I invited him to just give us a little bit, like a short version of what he was talking at his presentation, which was amazing. And if you could introduce us a little bit and tell us your, what you do, what are your qualifications. And
yeah. So I'm Dr. Bouzis D.D.S. I have an office in Seattle, Washington, where I treat chronic pain patients, everything from headaches to back pain, a lot of sports athletes, and I'm a chiropractor who specializes in cranial work, and which works on the cranium and the covering that surrounds the spinal cord. And what's interesting is I use brain spotting as part of the work because the midbrain is kind of like the bridge between the autonomic nervous system, the mind, and the body. And since I work with the body, I need to use the brain spotting as an aspect of turning on the autonomic nervous system to unwind our system. So I'm really excited to learn brain spotting and then implement that in my work. And so I came to the conference to show some things from resource perspectives from my work that can help with the brain spotting community. And so that's what I was sharing a little bit about emotions and how that affects the body in specific ways. And so one of the things we talked about was how kidney relates to fear. Fear affects the psoas muscles, which affects the back. And so there were points I showed that help with the patient that could hold those and act as resource points while doing the brain spotting to release those particular emotions.
Wow, you see how amazing it was? So it would be very nice to take him to Australia as well and give us a lot of more ways how to resource at the same time with the information of the nervous system. And I remember you did something very interesting about, could you just give us just that point that you said about putting your hand right here and then you find a spot in your head?
Yeah, the metopic suture is, as an infant, we have a suture right up the frontal bone, but as an adult it closes, but there's reflex points right up the metopic suture. And those are all your emotions. You know, there's 12 ribs, there's 12 emotions. It protects our heart. And so those points in the top, if you put your hand here and you go to the very end, is your soft spot, the bregma, and that's how you find it.
Yep.
And those right in front of that there's 2 points that relate to 12 and 11, which relates to kidney.
Yep.
And kidney is the area for fear. And so we hold those, and then there's some points behind the ear that we hold as well.
Yep. So these two, like
as
here and then behind the ear.
Yeah.
You explain more when we come to your workshop.
So I'm not going to tell you the rest, so you'll have me come out, right?
You have to come. We're going to just show you a little bit how.
Actually working on a whole thing where I can go through all the points. So we want to do like a one day where we can go through all the emotions, all the points, and then do it in a very combined way where you're using an attunement frame and patients can feel that.
Yes, great. And what do you think about the conference?
It was amazing, and the whole Brazilian community was so warm. The last speaker I was like searching for like what's Brazil, and then her presence and her talk was
nice.
That's what I like about Brazil, is about community, it's about spirit and enjoyment, and it's about having fun.
Yes, it is. It's like yesterday, we samba together.
You got to learn samba.
Yes.
So and that's what we're trying to bring in this work, is an attunement frame of trauma to joy, to fun.
Yes,
right?
and love.
Love.
Yes. Thank you very much. Thank you very much.
And that's what this brought.
Yes,
so
that's
what
this is all about. It's love. High five.
All right.
Thank you very much.
Thank you.
See you. Bye.
Bye.